Hello, everyone. Welcome to our NCLEX RN review session, live and kicking. So if you're new here, we are currently rolling through day 18 of our fantastic 90-day free NCLEX review series, and we are covering a wide range of nursing topics, breaking down 2,000 NCLEX questions with detailed rationals. Spread the word to your friends who are prepping for the NCLEX. Our classes are completely free. And remember to subscribe and turn on notifications to stay up to date with our latest content. And for more information, check out the description box below. And we do love hearing from you, so share your thoughts or questions in the comments and we'll be happy to provide further clarification on any topics. And we are also offering the NCLEX course at our website at www.stancoastnclexcoaching.com, where we've just got what you need. And the program is all about making studying enjoyable. So you'll find engaging lectures and a whopping 3,000 NCLEX top questions to help get fully prepared. Now, if you need a quick study session, we've got an audiobook and a concise bullet book to make things easier for you. And don't forget about our 10-hour animated video course along with 100 hours of prep time. It's all there for you to make the most of. And you can also access our on-demand video library and even practice with mock exams to build up your confidence. And this is something that you can access for a full 6 months. And this is going to include 200 NGN questions. And we've got everything at your fingertips to succeed. So you can study anywhere, whenever, what suits you best. And so we're here for you to support every step of the way. But today, guys, we will be talking about the nursing management for pleural effusion, also pleuritis. So let's get into it. Now, you're probably wondering, what is this pleural effusion? Well, it's easy, guys. So this is basically a condition wherein it will occur when there is an extra fluid buildup in the space between the lungs and the chest wall. That's the easiest explanation about that one. And so this is something that can happen for different reasons, such as way too much fluid being produced or probably not enough being removed. And so here, guys, in the US, over 1.5 million people deal with this condition every year. Imagine that. That's a whole lot of people having this kind of condition. Now, we have to talk about the different types of the pleural effusion. All right. One is the transfudative effusion. So what is this? This is something that can happen when there's way too much pressure in the blood vessels of the lungs. Let's say, for example, maybe in a case of a heart failure, there is now backflowing of the blood into the pulmonary circulation, or could be possibly caused by not enough protein in the blood, which can also cause swelling. All right, so think about that. Those are the type of transfudative effusions. Now, talking about the exudative type, this is something that can occur when there is damage to the pleura and also the lining around the lungs. And this is also going to possibly be caused by problems, caused by some infections or cancers or some inflammatory condition. Now, yes, for those who just join us, you can stay with us, and this is something that you can also use for your NCLEX LPN review. Now, here we got the next type here, the transfudative type of effusions. We also have the exudative, like I've said. Now, talking about the exudative here, these are things that can happen when there is damage to the pleura, where there is now a problem in the lining of the lungs, or it could be a problem in the drainage. And this can be caused by the infections, could be cancers, or inflammatory conditions. Now, with the transfudative type, you'll see there that there is probably some conditions like the congestive heart failure. There's also liver cirrhosis with ascites. This is what we call as the hepatic hydrothorax, wherein there is a movement of the fluid from the abdomen into the chest cavity. Now, one of those key factors is the pulmonary embolism, And also it can lead to an increasing pressure in the blood vessels, which can cause a leak of the fluid. And same thing with the syndrome, nephrotic syndrome, also peritoneal dialysis, wherein there is also an increasing pressure in the peritoneal cavity, which can force the dialysate through any existing defects that probably will cross into the weak areas in the diaphragm. Now, with the condition of hypoalbuminemia, this is the lack of protein in the blood. This is something that you will associate with low oncotic pressure, wherein it can allow the fluid to leak out of the blood vessels. And the same thing with atelectasis, it can also cause the pressure change that can lead to some fluid accumulation in the pleural space. Now we're going to move into the next section of our topic, which is on the clinical features. So I want you to focus here because this is where you're going to be asked most of the time. And so what are those things that you will be noticing in this patient with a diagnosis of pleural effusion? Well, to top that is the shortness of breath. And this is going to increase more when there is activity. This is what we call a shortness of breath with activity. And the reason for that is because of the fluid around the lungs can restrict the expansion and making it harder to breathe, and especially when the person engages in any kind of activity that would really require them more oxygen. All right, so that would be the first one, shortness of breath with exertion. And we have swelling in the extremities. Why? Well, because pleural effusion can be associated with some conditions like the heart failure, which can cause the fluid to accumulate in the body. And this will also lead to swelling into the legs and the lower extremities. Now, you also have to check onto the difficulty of breathing when the patient lies down in a supine position, let's say, or a reclining position. So these type of positions can actually cause the person to have that difficulty of breathing. It's because the fluid is spreading out more evenly, especially in the chest area. And so we'll add the pressure into the lungs and will make it harder for the person to breathe. Now, there's also some complaints about maybe nighttime breathlessness. And this is something that can occur due to the shifting of the fluid when the person lies down. And this can cause the increase in the pressure on the lungs and leads to sudden breathlessness. And this is what we call as the paroxysmal nocturnal dyspnea. Okay, again, that's the PND, paroxysmal nocturnal dyspnea. Now, there are also symptoms. Let's say, for example, the reduced resonance on the percussion. Now, why is it like that? Well, normally the chest sounds hollow when it's tapped because it's filled with air. However, when there is increasing fluid inside the pleural space, then this makes the sound duller because it doesn't really resonate like the air. And there's also going to be a lowered breath sounds or decreased breath sounds over the consolidated area because the sounds now are going to be reduced as the fluid will dampen the sound of air moving in and out of the lungs. Now, we're also going to notice that there will be some decreased tactile fremitus. So when you're doing your assessment, when you're going to ask the person to say 99, 99, the vibrations will actually travel through the lungs to the chest wall, and the fluid in the pleural space dampens these vibrations, and it makes them less noticeable when you are applying your pumps over their posterior or anterior chest. Now, this time we're going to talk about the different diagnostic tests that will really help out in determining this patient for this diagnosis. So one of the diagnostic tests that we'll be talking about is the chest x-ray. So what is this? This is something that can be ordered as a PA and lateral, and this can look for and show those blurred angles at the bottom of the lungs if there's any fluid accumulation. And approximately 250 ml of the pleural fluid is needed for this chest x-ray to detect this kind of condition. And so this will involve also lying on the patient's side, and it's good for spotting the smaller amounts of fluid as well. Now, another test that will be beneficial is the CT scan of the chest. So this will give us more detail than a chest x-ray, and it will be better for detecting smaller type of effusions as well. Now, another diagnostic test can be used is the thoracentesis, and this is something that will evaluate new pleural effusions, and this can also provide about 70% diagnosis in about 75% of the cases, and this can also give critical information even if not diagnostic. And also with the thoracentesis, this is something that needs to be avoided if in case the pleural effusion is in its littlest amount, less than 100 ml, or when the fluid is quite thick. Now here we go with the different treatment modalities. Now we'll focus first onto the transitive type of effusion, and so you will be expecting that the medical provider will be ordering diuretics in order for us to get rid of the extra fluid in the lungs, especially in the pleural space. One of those diuretics is the loop diuretic, Lasix. Okay. Now, in order to prevent the fluid to retain some more in the lungs, we are going to restrict the intake of sodium, and also the use of the therapeutic thoracentesis is going to be ordered if the large effusion causes shortness of breathing into this patient. Now, for the next type here, the exudative type of effusion, the goal of treatment here is to actually get rid or to treat the underlying condition which has caused the fluid buildup. Now, at this point, with the different other types or the other types of pleural effusion, it could be the parapneumonic type. This is caused by the pneumonia. Especially if it's not really complicated, the antibiotics alone can usually resolve this kind of problem. However, if this is going to be complicated or it's now going to involve some empyema, then definitely this will involve drainage with the use of a chest tube. And so when the fluid into the pleural space become infected or let's say thickened, it needs to be drained to relieve the symptoms and in order to prevent further infection as well. And so this is going to include the insertion of a chest tube through the chest wall into the pleural space to allow for continuous drainage of that fluid. Now, there's also going to be the injection of the fibrinolytic agents. So, for example, we have the medication names, streptokinase, urokinase, or the TPA, the tissue plasminogen activator. These are going to be injected directly into the pleural space. All right, so what is the purpose of injecting or administering these medications? Well, this are going to help break down the fibrin, which is a protein that can cause the fluid to become thick and loculated, meaning it's compartmentalized. So this is really going to help break down and speeds up the drainage process by making the fluid less viscous and easier to drain through the chest tube. Now, there's also going to be a surgical removal of the adhesions, and this is something that we call as decortication. This is because of the thick fibrous bands or adhesions within the pleural space. This can really cause some trapping of the fluid and prevent complete drainage. And so the surgery is going to be done to remove these adhesions and allowing the fluid to be fully drained, and will reduce the risk of ongoing infection or let's say chronic pleural disease. And so to summarize the different treatment modalities here, we have the chest tube drainage, which physically removes the fluid by gravity. And then we also have the fibrinolytic agents, which are going to chemically break down the thickened fluid to enhance the drainage. And lastly, we got the surgical removal of the adhesions, which can manually remove the fibrous bands in order to allow the complete drainage and to prevent future complications. All right, so I hope you're able to follow all those treatment modalities. We're going to talk about the treatment of the malignant type of effusions. So if in case the person might have some type form of a cancer in the lungs, then they're going to benefit this type of procedure or diagnostic test, the video assisted thoracoscopy, or known as the VATS. So what is this? This is basically a minimally invasive surgical procedure that is going to use a small camera known as the thoracoscope, and this is going to be inserted through the chest wall. And the purpose for this type of diagnostic test or procedure is to allow the direct visualization. It will allow to obtain biopsy tissue and also to treat the pleural effusion. Now, talking about the chest tube drainage is really common in the treatment of the different type of effusions. This will provide a much more continuous removal of the effusion to relieve the symptoms and prevent the reaccumulation of the pleural effusion. Now, for those patients that have cancer, the radiation would be a treatment modality with the use, of course, with a high energy radiation that will kill cancer cells. And they're going to target the malignant cells causing the effusion, which may reduce the fluid production. Now, the same thing for the cancer patients, chemotherapy will also be used in order to treat the underlying malignancy, and this will potentially reduce the effusion formation. Now, for the other diagnostic or treatment modality is the thoracentesis. So what is this? This may only offer temporary relief, as the infusion or the effusion can only occur within just a few days. Again, thoracentesis in this type of effusion can be so temporary. Yes, it is good for LPN as well. So you can stay with this within our class. Now, on top of that, the Pleuritis is another procedure that will be included in the treatment of malignant tumors as well, or malignant effusion. So what is going to occur in the procedure Pleuritis? Okay, this is going to allow the creation of adhesions between the parietal and also the visceral pleura. And of course, this is going to use the tube, or known as a thoracostomy. And this will now drain the pleural space by injecting a sclerosing type of agent. And we have the examples here, the tetracycline and also the doxycycline. So these are antibiotics that are going to be injected into the pleural space. And the reason for that is to cause the site to be irritated. It will be inflamed, okay? So before we head into that, we're going to have to assist the medical provider in positioning the patient, okay? Make sure that the patient is in a comfortable position, and as the medical provider is introducing the medication through the tube into the pleural space, and the tube is going to be clamped after that. And the process will proceed with positioning the patient into different position, and this will be done at least 3 to 5 minutes for each position. And the reason for that is to ensure that the medication will spread evenly into the pleural surfaces. All right. And then after that, the tube is going to be unclamped as directed, and the chest drainage will continue for about 24 hours or more. Now, over time, within that limited time frame, the medication that was injected into the pleural space will cause the irritation, it will cause the inflammation and fibrosis within the pleural space. And with that, it will now cause those two layers, the visceral and parietal layer, will be causing it to adhere to each other. And when they're brought together, this will now cause a negative pressure from the chest suction. Okay, so that is the main reason why the pleuritis is going to work for this patient with the malignant type of effusion, because of the recurrence. There is much more of a rapid recurrence of the pleural effusion because of the cancer cells that's causing this extra fluid to accumulate. Now, this time we're going to talk about the nursing actions that will be used that will benefit the patient with a pleural effusion. So we'll start our nursing process with the assessment, of course. Now, your role here, guys, is to collect the medical history of the patient, and this will include all previous lung conditions in order for us to potentially identify those causes and also the risk factors for this condition. Now, we are also going to check the patient for any shortness of breath, tachycardia or tachypnea rather, and also for any signs of fluid overloads, because these are the symptoms that indicate that there is presence of pleural effusion, and it's really going to impact on the patient's respiratory function. All right. Now here, guys, we're going to have to continue your assessment. Of course, you're going to have to auscultate and also do your percussion in order to detect the abnormalities, correct? And so when you're listening to the lungs with the stethoscope, you can hear some absence or maybe reduced breath sounds where the fluid is present, okay? So it will be diminished. And when you are tapping, when you are percussing the chest wall where the consolidation is, then the sound will be dull compared to a normal air-filled type of lung. And so those are the key assessment findings. Again, there will be dullness on percussion. That's one. And also there will be reduced breath sounds. Let me just put BS here for breath sounds. Dullness and reduced breath sounds over the lung fields that have the fluid collection. Now let's move ahead with the nursing interventions here. So what can you do for this patient? Well, you're gonna respond to the different complaints by following what the doctor has ordered for this patient. So one of those treatment will include the administration of the diuretic. And this is going to get rid of the excess fluid in the pleural space. And also we're going to administer the antibiotic for the treatment of the infection, let's say in a case of pneumonia. All right. Now, we're also going to assist the medical provider in the procedure, especially when they're going to do the thoracentesis. And this is something that can be done in the interventional radiology suite, or it could be done at the bedside. And our role here, guys, is to assist the patient by preparing them, supporting the physician, and also monitoring the patient during and after this type of procedure. Okay. Now, after that, we're going to have to maintain the chest drainage as needed. And what do we do with this type of procedure? Well, we are going to monitor continually the chest tube in order that it is functioning properly and to continuously remove the fluid from the pleural space. Now, after we assisted the medical provider in doing the Pleuritis procedure, then we are going to monitor the patient for excessive pain because of the sclerosing agent. Yes, they are quite painful. And so this might cause the patient to somewhat not really exert effort in breathing in because it's quite painful. And so our role at this point will be to administer any kind of prescribed medication to relieve the pain. And if it's not controlled, then we really need to notify the medical provider, because this might require the installation of a lidocaine, and this is something that the medical provider will be doing. Now, so we have a comment here from Kuzbu. Diminished breath sounds is priority in NGN question, or not actually. I saw it in many. Well, diminished breath sounds is just one of those manifestations. Okay. You would probably not categorize this as a high priority. It's just one of the manifestations because mostly the patient that has the pleural effusion actually will have the shortness of breath, and there is going to be hypoxemia. That is the priority at this point. Whenever there is now a problem in the oxygenation, okay, when there is a problem with the breathing, then that's where you're going to have to really prioritize. Okay, so I hope that you're able to understand the severity or where we are going to pay attention. Okay, I'm just mentioning here the different manifestations that you need to capture. Okay, now we are also have to provide education, especially when they are complaining about the pain. We can help them reposition with the best or whatever position that can really relieve their pain. Okay. Now, aside from the notification to the medical provider if in case their pain is uncontrolled after the pleuritis, then we are going to also administer oxygen as needed if they get short of breath and if their levels is going to be down. And we have to observe for their breathing, also the oxygen saturation and other vital signs for any worsening of their condition. All right. Now, our patient education will include advising the patient to seek early intervention for any unusual shortness of breath or any signs of heart-lung or any associated problems that will happen with the lung disease. Now, we are going to talk about the next problem here, which is on pleurisy, or known as the pleuritis. So this is going to involve the irritation and also swelling of the lungs, outer and the inner linings. And so let's get into the pathogenesis and also the causes of the pleurisy. So this is something that can develop due to the various factors. And so the most common causes will include those kind of lung infections such as the pneumonia, or maybe issues with the blood vessels like the pulmonary embolism, could be the TB, also bacteria and viruses infecting the lungs, maybe a abscess, or it could be other respiratory infections that can lead to the pleurisy. All right. Now, what really is important here is to point out the presenting complaint of the patient, and this is often the pain. All right. The pain is very debilitating that it can cause the patient to at least stop breathing. Okay. So because the pain here is so intense, it will activate the nerve endings and will lead into the discomfort. Okay. The discomfort here is so severe, like I've said, that again, it can also cause irritation and also cause excess fluid to collect into the pleural cavity and will lead into the pleural effusion. Okay, so the pleurisy and the pleural effusions are quite interrelated. All right, and so with the complication here, the patient is at risk really to develop the pleural effusion, which is really the major complication. But aside from that, when they are breathing so slowly because of the pain, then they can potentially end up with a lung collapse, or known as the atelectasis. Okay, guys, because of the intense pain, the patient will now breathe very slow. There is no hypoventilation, and then the patient will end up with the lung collapse or atelectasis. And aside from that, they're gonna have that pleural effusion, which is basically the fluid collection into the pleural space. Now, we are going to talk about the different assessment findings. And again, we are going to focus into the chest discomfort. This is the hallmark sign in the patient having the pleuritis. Okay. So again, the chest pain here is quite intense. All right. Because of the inflammation and the irritation of the two surfaces here. We have the pleural viscera and also the parietal pleura here. Okay, the visceral pleura and the parietal pleura rubbing each other, and this is going to cause that piercing chest pain. And this is going to be much more intense when they inhale. All right, and this is why we call as the pleuritic chest pain. And the pain is somewhat kind of diminished when the patient stops breathing. So yeah, this is the most comfortable spot that they're going to have. To stop breathing will actually give them some minimal relief. And so the patient will really end up with some hypoventilation because of that. All right. Now, we're going to have to, let me get rid of these. And so we're going to also identify that the kind of chest pain that they're going to experience here will really disappear, or it will lessen when they hold their breath. This is the classic sign. All right. And I've said already that this is one of the reasons why they're going to end up with lung collapse. Now, the pain here is going to be localized, and sometimes it can spread to the shoulder or belly. And the sensitivity between the ribs upon touching and also can be assessed in this patient. They're going to be so sensitive, guys. And also, there is that harsh pleural friction rub, which is going to be somewhat kind of a leathery sound when you're auscultating, when they're breathing. And this is another key manifestation in assessing the patient with pleuritis. Leathery noises, okay? And these type of sounds are often heard low in the armpit, okay? Or maybe at the back of the lung base. So this is where you are going to hear those type of pleural friction rub, okay? Again, heard low in the armpit or at the back of the lung base, okay? Right, those sections. Now, the patient will also manifest some signs of infection. Could be fever, could be fatigue, and the elevation of the white blood cell count can be evident when you are looking into their laboratory results, especially the white blood cell count. So this is in response to the inflammation in the between those tissues, the parietal pleura and the visceral pleura. So at this point, guys, we're going to talk about the different diagnostic tests. And if you're going to ask what diagnostic tests are usually performed, well, you'll see that chest x-ray can really reveal pleural thickening, and also the sputum exam can help identify the kind of infection the patient may be having, and also the fluid that can be obtained from the pleura through the thoracentesis can be analyzed for any kind of pathogens, and in some instances, the biopsy obtained might be necessary in order to rule out other diseases, okay? Now, if you're going to ask me, what are those treatment modalities that can help the patient this time? Well, the primary approach of the treatment of the pleurisy is actually to do it addressing the underlying condition. So if the patient's cause of the pleurisy is pneumonia, then definitely we're going to have to treat it by administering antibiotics, right? Or let's say we are going to manage the infarction, okay? Now, once the primary issue is resolved, then the irritation will also subside. So that is expected. However, though, the relief of pain is something that we really need to maintain for this patient, make sure that they're getting enough pain relief. And this is something that you can achieve by teaching the patient when to exactly take the medications when they are being instructed for home use. And when they're in the hospital, in the acute care setting, of course, we're going to have to periodically check for their pain levels, make sure that they are evaluated if the pain level has been controlled, and make sure we notify the medical provider if their pain is not well controlled. Okay. Now, again, the patient might also benefit this kind of treatment modality, which is the administration of intercostal nerve block. And of course, will really help out the patient in maintaining much more of a regular breathing pattern. All right. Now, at this point, we're going to talk about the different nursing actions. You see here a very long list. So again, your nursing assessment will start. And so you have to really assess the patient's pain level according to the onset, when exactly it started, the quality of the pain, the location, the severity in a scale of 1 to 10, and also ask them what aggravates the pain, and also what helps them out when they experience the intense pleuritic type of pain. Now, at this point, guys, you really need to assess the patient's breath sounds. This is very important because when you are possibly capturing those crackles, or let's say the pleural friction rub, definitely the patient now has now the complication, the pleural effusion. All right, and this will now cause them to be more short of breath, and then their breath sounds will be more diminished. When you're percussing, they are somewhat consolidated, and so there will be some dullness. Again, these are just supporting manifestations. However, though, you have to prioritize those manifestations that can affect their airway, their breathing, and their circulation. Okay, those are the most important thing. Now, you're also going to have to assess the patients for the following signs. The shortness of breath. Well, this is really a sign that they're not getting enough oxygen. So this is a priority assessment finding, right? So what are you going to do? Well, of course, you're going to do something about it, right? You're going to have to assist them in a very comfortable position, at least in a sitting upright position. And if they're hypoxemic, then what are you going to do? You're going to have to at least start giving the oxygen, starting with the low flow oxygen according to the physician's order. And if not, then we're going to have to proceed with a different oxygen delivery system, right? And the reduction of the breath sounds really is something that can also support the diagnosis of the pleurisy whenever they are developing the pleural effusion. And the dull percussion, like I've said, this is more assessed on the affected lung, okay? And again, we're going to auscultate the patient for the pleural friction rub, and this is much more heard close near the lower side of the armpit and also the posterior lung areas, okay? Now, for the nursing interventions, again, repositioning is one of the top nursing interventions that we can do. And what we're going to instruct them to do is to lay on their affected side. Please pay attention, especially if the patient is having the pleuritic pain or pleurisy on the right lung. Then you are going to instruct the patient to lay on that affected side. And this is the reason it will reduce the pleural stretching and also will reduce the pain. That is the rationale for that. And again, when they are going to do the deep breathing and when they need to cough, you will instruct them to brace their chest to do that. And this is going to lessen the painful sensation while they're doing the coughing and deep breathing exercise. Like I've said earlier as well, pain medication will be important in regulating their pain, controlling their pain, and make sure that you are going to evaluate once the time frame has passed. Let's say, for example, if you are giving them an IV type of pain medication, then within 30 minutes, you are going to evaluate that pain level. Or let's say oral pain medication, it would be appropriate to recheck their pain level after, let's say, 45 minutes or about an hour, because that's usually the time frame for the medication to have its therapeutic effect. Now, there's also going to be application of the heat, and also this is going to provide some pain relief when you're administering it to the local area for at least like 20-30 minutes. This will relieve some pain and also muscle relaxation. And if the medical provider has planned on doing the nerve block, then definitely assist the patient during the procedure. And monitoring the patient for the hypoxemia is a big deal. Like I've said, they're going to be used to holding their breath because that is only going to give you an indication that the patient really is not taking in enough oxygen. And the question here, why are they lying on the affected side? Yes, the reason for that is it will reduce the pleura from stretching. All right, so this is the rationale right here. It will reduce the pleura from stretching when they are on the affected side. Okay, that is the simplest reasoning. All righty. Now, we are also going to teach the patient, and this is going to be a key patient education. When they're going to be sent home after we have treated their main complaints in the acute setting, we are going to have to teach them to at least call their medical provider if in case they're going to start having that shortness of breathing again. All right, because like I've said, one of the contributing factors could be caused by the infections, and there might be some recurrence. Okay, and they need to really monitor themselves at home to report those signs that are associated with the pleurisy, any signs that could really affect their breathing, if there's any reduction in their, let's say for example, their O2 saturation. Usually they're going to have that device as well at home so they can check themselves if they are still getting enough oxygen. Well, it's very important that they have to notify their medical provider right away. Okay, so that ends our lecture today. I really hope that you were able to capture some important aspects in the care of this patient with a pleural effusion and also pleurisy. And I highly recommend that you're going to review your notes regarding the topic. And after that, make sure that you test yourself with those NCLEX questions about the pleural effusion and also the pleurisy, so you will be able to know if you had gained some understanding about the disease process. So happy reviewing, and I'll see you again tomorrow, and we'll talk about the aspiration pneumonia and other types of pneumonia. And you take care and have a great day. All right, bye-bye.